I'd like to thank the organizing committee for the honor of the podium. These are my disclosures. I've got another disclosure that I'm a big fan of Star Trek and Star Wars, and it's only befitting that I'm talking about artificial intelligence today. My objectives for the talk today is that I'm going to start talking about a glossary of some of the commonly used terms and their definitions. I will then go through the healthcare applications of artificial intelligence and some practical examples. I will then talk about surgical automation and then end with some limitations and ethical considerations of artificial intelligence. I see that you guys are very strict with time, so I'm going to limit myself to definition of artificial intelligence for the sake of time. AI is the replication of human intelligence. In machines, these systems are designed to think, reason, learn, and carry out tasks, either independently or with little human intervention. Using artificial intelligence in healthcare generally and in cardiac surgery specifically is not novel. It's been taking place under our noses for many years. However, it was not until OpenAI, which was created with the mission of bringing artificial intelligence to the masses, and its introduction of ChatGPT in November 2022, that AI became a big hit and a sexy topic. From the definition we should have heard, we would have learned that Amazon was using artificial intelligence on its e-commerce platform before ChatGPT came out, and Google Translate recognized language and offered translations, but it was called machine learning. Computer scientist Alan Turing founded machine learning back in the 1950s. He was instrumental in cracking the code for the Enigma machine, which enabled the Allies to intercept messages from Germany to its fleet in the Second World War. This played a significant role in Germany's defeat. But if machine learning and AI were invented in the 1950s, why has it taken until now for the technology to be developed? These systems require large amounts of data. Data was analog back in the day. We used paper and pen. And it was not until internet was developed and large computers were invented that data became available, and we were able to utilize the vast troves of data we collected on a daily basis. Let's talk about applications of AI in healthcare. If you review the literature that examined the role of artificial intelligence in healthcare, you'll see that it falls into these general categories. Firstly, diagnosis, computer vision that is used to determine objects, recognize images, and identify patterns is now used in chest x-rays to detect lung cancer, as well as other studies like CT scans, in pathology to enhance the images obtained from biopsies of prostate and otherwise, and improve the diagnosis of cancer. And in dermatology, artificial intelligence has enabled improved cancer detection with high accuracy, specificity, and sensitivity. In cardiovascular medicine, the application of machine learning methods has revolutionized the diagnostic and prognostic capabilities in the field of cardiac imaging. With the advancement of echo machines and the adoption of more AI tools, all echo studies benefit from better image optimization, automated measurements, and automated calculations of strain, ventricular volumes, wall thickness, and ejection fraction. Additionally, every 3D echo is enabled due to the machine learning tools incorporated in the new echo machines. Coronary CT benefits from the use of machine learning algorithms by improving results of calcium scores. And the utilization of machine learning has allowed for the development of CT FFR with promising results. Machine learning algorithms are impacting every aspect of the diagnostic process using CT scans and is facilitating improvements in image quality, reduction in X-ray dose, and better outcomes for patients. In the cath lab, AI-based tools are now helping automate the analysis of image modalities utilized and aiming to streamline these techniques and enhance cardiovascular diagnosis and treatment. Starting with the coronary angiogram, numerous studies have demonstrated the feasibility of utilizing angiographic patterns and characterizing lesions with fair results with the ability to detect diameter of stenosis, calcification, thrombus, and dissection. With regards to intracoronary imaging, OCT, IVUS, and FFR are enabled through the use of AI applications. Interoperative guidance is provided by displaying information during a procedure or by reviewing the flow of a procedure and suggesting alternative options. This is already offered with Da Vinci 5, the latest robot from Intuitive. I've not used it, and Intuitive has stopped supporting cardiac surgery procedures. Those who have used the latest iteration of Intuitive robots in supported fields tell me that during the case, the system takes advantage of what is called digital solutions and provides actionable insights throughout the case. Without a platform adopting cardiac surgery, it is hard to see how this could be brought to our field. Third on the list was the applicability of these algorithms in predictive analysis, and it's also shown interesting results regarding risk stratification of patients in 8 crucial domains where AI improves clinical predictions, notably in diagnosis, prognosis, and personalized medicine, especially in oncology and radiology. In this nice systematic review, all studies had clear predictive outcomes and defined AI component. Many of the studies identified are in the area of cancer and not many were in cardiovascular medicine. The majority of the publications, obviously understandably, are within the last 2 years. And I think this is a good area for collaboration with probably some engineer to validate a machine learning model with an existing conventional statistical predictive model. In medical education and research, it is widely known that ChatGPT was able to pass the USMLE exam, and many thought that ChatGPT can replace doctors. However, as it stands, this technology is unable to replace doctors as yet. There are many elements that go into being a physician other than the ability to regurgitate information and being able to answer questions. In research, ChatGPT is being used for proofreading, and this is generally acceptable. Additionally, ChatGPT is being used to write abstracts and sometimes whole manuscripts. Although this is getting more acceptable, authors are required to disclose if AI has had a role in writing their work. Some AI-enabled research tools include consensus AI that would give an answer to questions with a rationale and the evidence used to reach this conclusion. For example, I asked it about treatment options for someone with triple vessel coronary artery disease, and it gave me the answer that coronary artery bypass is generally considered the best treatment option, listed clear indications, and then went on to list trials it used. Another tool that came out of a research project in Harvard that looked at the decisions that doctors made on a daily basis and whether they were supported by evidence. It turns out that more than 80% of the decisions don't have any existing evidence to support them. And they turned this into this tool that would search for real-world evidence for questions. Both, I think, are great tools to be used. Moving on to surgical automation. Through the combination of artificial intelligence and robotics, surgical automation will become a reality. And although we're not quite there yet, however, the future operating room will look something like this, with the surgeon and their assistant either only performing critical parts of the operation or on standby for troubleshooting throughout the whole procedure, just in case something goes wrong. If you think this is not possible, let me tell you about a couple of research coming out of Johns Hopkins. The first, they were able to train Da Vinci robots to perform surgical procedures. The researchers used video recordings of surgeons using the robots, fed them into the AI model based on ChatGPT architecture, but instead of words, the model used imitation learning, kinematics. The language breaks down angles of the robot motion into math. They found that even with a few hundred demos, the model is able to learn procedure and is good at learning things that it demonstrated skills, even if they haven't taught it how to do them. Another team at Johns Hopkins also was able to perform in vivo autonomous robotic laparoscopic surgery for intestinal anastomosis. They were able to show over 1 week survival period in these animals, so surgical automation is coming. But what are the limitations of AI models and using AI in medicine? One of the main limitations is transparency. The predictions or the recommendations that the AI generates cannot be checked to see if they were based on sound judgment. The fundamental basis of these systems involves feeding data that passes through a hidden layer to extract outcomes. Although data are analyzed using algorithms, the exact mechanism of analysis remains unclear, leading to a lack of ability to interpret and trust the predictions. A fear of potentially catastrophic consequences from unrecognized error has slowed wide adaptation. This is especially a concern when we learn that AI models suffer of hallucinations, where it perceives patterns or objects that are non-existent or imperceptible to human observers, creating outputs that are either nonsensical or altogether inaccurate. The problem of bias, particularly in the context of surgery, is a significant concern. AI models are trained on large databases that may contain inherent biases reflecting historical disparities and inequalities. As a result, ChatGPT may inadvertently perpetuate or amplify these biases. An example of this is the tendency of old models, the old version of ChatGPT, to lean towards showing photos of Filipino ladies when asked to show a photo of a housekeeper. Another example is an algorithm which was more likely to classify a dermatological lesion as malignant if processed images had a ruler in them. This is because the data set it was taught on showed rulers next to malignant lesions. Thus, every time it saw a ruler, it assumed that the lesion was malignant. There is the added concern about breach of confidential health information. This is especially the case when using large data sets. Finally, if AI recommends a decision or it acts autonomously based on this decision and an error takes place, who is liable? The doctor, the hospital, or AI? At the end, I will leave you with this analogy. ChatGPT and artificial intelligence has just passed its USMLE exams. Is it ready to be an independent physician? The answer is no, not yet. But it is going through its residency, and as a resident, you will be able to utilize its abilities in extracting data from charts, getting a history and documenting it in the EMR, help you prepare a talk, or do literature review, and maybe help you out in parts of the surgery. With time, however, it will mature, learn, and acquire all the skills it needs to become a good physician, and we, or our younger colleagues, will be forced to work with it, whether we like it or not. Thank you very much for your attention.